Hello everyone, and thank you for the opportunity to speak at this Digital Health Festival. I would like to begin by acknowledging the traditional custodians of the lands upon which all of us are meeting. For myself here in Sydney, it is the Gadigal people of the Eora Nation. I pay my respects to their clans and to their elders past, present and emerging, and acknowledge their continuing connection to land, sea and community. I also acknowledge and pay my respects to all of those with a lived and living experience of mental ill health and suicide. It is for that reason that we do the work we do in the Commission, and the contribution of everyone with such a lived experience is critical to our work. This Digital Health Festival comes at an important time for digital mental health reform in Australia and globally. In Australia, we know that the COVID-19 pandemic and the natural disasters such as our bushfires and floods have created significant challenges. But one of the silver linings has been the acceleration in what we have of necessity had to do online. It has really propelled forward all of the work we're doing in eMental health. This places us now at a very significant inflection point, particularly when we take into account the significant Reform Act initiatives across our national mental health and suicide prevention systems. The critical component is ensuring that as we go through that reform agenda, that we ensure that all things eMental health are integrated into those reforms. They are not only a critical part of the way forward, but in fact will lead the way forward when it comes to the delivery of mental health services for any Australian, wherever they may be, at whatever time they need it. At the moment, we know that the digital mental health landscape is made up of literally thousands of psychological crisis and counselling support platforms, apps, service deliveries, telehealth, and self-guided online options. They're funded, managed and run not only by government but also by non-government and private organisations. There's almost an overabundance, I would say, of online tools and apps, with the number, as we've said, having increased significantly during COVID. The opportunity for Australia, and this is one that the National Mental Health Commission is very focused on, is to develop what we are calling a national digital mental health ecosystem. Why an ecosystem? What do we mean by a digital ecosystem? In an ecosystem, the person who is using it needs to ensure a seamless experience. They need to ensure that all of the mental health tools and services are working together. However, for an ecosystem, it goes beyond. It goes deeper to look at the underpinning platforms and the back engine, if you like, of how to ensure that user has a safe as well as a seamless experience. It looks at things such as making sure things are fit for purpose. What is our governance? What are our laws? What are the regulations? What are the safety protocols? What is the accreditation? And how do we ensure that going forward all components for a seamless, safe ecosystem are put into effect? As we would always hold to in the Commission, one of the most fundamental principles when you're looking at creating anything is to hold true to co-design. We must ensure that the experience of the person with lived experience is integrally involved in both the co-design and the delivery of the ecosystem. We need to take into account not only that person's experiences, but what is needed to improve their mental health and well-being, how to improve their life, and most importantly, how to remove any barriers to access. Here in Australia, that's particularly important, as we know, for our rural and remote areas. But it's not just here in Australia that we recognise the necessity to integrate what we are doing in eMental health across into mental health reform initiatives and broadly into an ecosystem. There's actually strong international recognition as well. Countries are working together and learning from one another how to achieve this. And if we look at the very essence of eMental health, you can see there is an immediate breaking down of international barriers. We need to ensure that what we're doing here in Australia has recognition that it will be accessed internationally, and ensure that the protocols, the safety, the governance that we require at a minimum standard in Australia is adhered to. We are looking to and working with our colleagues in places such as Canada, New Zealand and the United Kingdom. Here in Australia, I do want to stop and acknowledge the vibrancy and the robustness of work that has been done to date by so many people in our digital mental health sector. One of the most wonderful contributions, I think, was with the design and delivery of Reach Out in 1998. Gosh, that's going back some time. It was a development of an online tool that has had critical reach to our young people and has been recognised internationally. I want to take my hat off to my wonderful colleague, Professor Helen Christensen, and her colleagues working at the Australian National University, the Black Dog Institute and elsewhere. They have led the development of pioneering online tools right through the 2000s. But, and I stop here and really emphasise but, with as many as 20,000 mental health apps existing globally, there is a real and present danger that without a national digital mental health ecosystem which ensures safety and integration, then such apps, platforms and technology development will not operate in a compliant manner that is safe, reliable and sustainable, delivering evidence-based outcomes and improving the quality of life for those who need to use it. Commonwealth, state and territory governments here in Australia and private providers have invested in technologies, but there is nothing that is threading it all together. A digital ecosystem will achieve this, but it must be developed effectively. In Australia, there is a further thing we must take count of. It must be developed in line with the National Safety and Quality Digital Mental Health Standards, developed in 2020 by the Australian Commission on Safety and Quality in Healthcare. The Australian Commission on Safety and Quality in Healthcare partnered with service users, consumers, carers, families, clinicians, service providers and technical experts to create these standards. They were officially released in November of 2020 and they aim to ensure the quality of digital mental health service provision and, most importantly, to protect service users and those supporting them. There are 3 standards and they include 59 specific actions which relate to clinical and technological aspects of digital mental health services. They describe the level of care and the safeguards that a digital mental health service should provide. Just briefly, the 3 standards are, firstly, clinical and technical governance, how we actually govern what we do clinically. Secondly, partnering with consumers. You've heard me say already the critical importance of ensuring that anything we do is co-designed with service users. One of the things I'd really like to call out is we need a broad diversity of those with lived experience to ensure we are truly capturing that. And the 3rd standard is around models of care. But it's not enough to simply have the standards to refer to. We need to continue to evaluate them into our mental health ecosystem. Evaluating the outcomes of the digital mental health services in line with the standards will contribute to building the evidence base to ensure that we can do this safely. But one of the things the Commission is also exploring is whether there are some formal forms of accreditation that can be introduced. At the forefront of worldwide digital mental health reform is a group of global subject matter experts, all of whom are collaborating and sharing their knowledge on all topics related to eMental health. This group is called the eMental Health International Collaborative, colloquially known as EMIC by those of us involved with it, and I'm really privileged to be its current chair. EMIC's aim is to support a future where all people have access to safe and effective digitally enabled mental health services, to ensure that they are covered across the spectrum of prevention, screening, treatment and ongoing support. There's an incredibly important piece of work that has been undertaken within the umbrella of EMIC, and it's been recently released. It's a position statement titled Ethics and Law as Essential to eMental Health. It's a statement which has been strongly endorsed not only by us here at the National Mental Health Commission, but internationally by the Mental Health Commission of Canada, by the Institute of Mental Health in Singapore, and by Sweden's municipalities and regions. It's also received the endorsement of UNICEF. Now, this position statement, by its very title, you can hear that it looks at the underpinning issues of ethics and law, which are a critical component of an eMental health ecosystem. It includes 7 principles, and this we call for the guidance of what we do as we go forward in eMental health. We need to understand that these principles not only apply to the application and delivery of service apps and like, but they need to be brought into effect at pre-development time as we test out the ideas and deciding whether to proceed, whether we go ahead and design, how we use things such as disruptive technologies, artificial intelligence. We need to consider this before we develop some of our services and apps, not just to their application. If you like, the principles should be considered as living principles. They need to continue to evolve to ensure that we are meeting the needs of the ecosystem. But where we stand here in 2022, these 7 principles, really critical ones, as I say, internationally endorsed. Firstly, we need to partner and have active involvement with people with lived experience. You can hear a theme coming through here. It is actually not possible to do mental health without taking into account lived experience. Why? Because unlike our physical health, where we can see something which is not right, like such as a broken bone or something else from a physical perspective, or do a test for it, with our mental health, we need to engage with how people are thinking, feeling and behaving. We need to understand it from their human perspective. And unless we are fully engaged with the lived experience perspective, we cannot possibly design the right services. So that is critical as an underpinning principle, the first principle for this position statement. Secondly, privacy. We must grapple with the fact that data will be collected, held and used in different ways, and how important it is to ensure confidentiality. We need to look at accountability, at safety and security, and on that one, I pause and keep reminding everyone of the criticality of our do no harm approach. Transparency and explainability, fairness, non-discrimination and equity, and professional responsibility and evidence-based practice. In addition to the principles, there's been a growing appreciation, though, for the relevance of international human rights and its application to the governance of new and emerging technologies and to policy, practice and laws related to eMental health. eMental health practices must enhance human rights, promoting the right to the enjoyment of the highest attainable standard of physical and mental health care. So, the delivery of quality, compassionate, person-centred care actually is not possible without established ethical principles, professional codes of conduct and adherence to the norms of law. As our reliance on the provision of digital services grows and digital service capabilities increasingly cross international borders, it is essential that we establish frameworks that will ensure the delivery of services of the highest quality and standard of care. The National Mental Health Commission welcomes eMIC's position statement. It is a critical starting point to establishing foundational requirements for eMental health initiatives that are ethical, informed by lived experience, and respectful of international law. The Commission looks forward to continuing to connect, work with, and contribute to the wealth of expertise and experience that is needed to realise the full potential of our eMental health services within a well-established, internationally recognised eMental health ecosystem. Thank you.